We're here now with Dr. Karen at the Shedd Aquarium's Veterinary Hospital with a patient, the common carp. What are we going to be doing with this fish today?
Well, today we're going to do what we call a preventive exam on the carp, and that means basically it's just a routine checkup. So just like you go to your doctor for routine checkups, we do the same with our animals. And so we can go ahead and look at their gills, look at their skin. We can take x-rays if necessary, basically just making sure that they're healthy.
We have our carp patient now. What's the first step in the medical exam?
That's a really good question. The first thing we're going to do is we're going to gently sedate the fish so that we can take some samples from them. Otherwise, they'll be flopping all over the place. So what we do is we actually have a powdered anesthetic because these guys breathe water. So, for dogs that breathe air, we'll have them breathe gas. But if we put gas into the water, we would all be breathing the gas that comes out and all end up on the floor. So what we do is we have this powder. It's called MS-222. That's an easy way to say it. It's tricane methanosulfonate plus a buffer. And basically we dissolve it in the water. It's of a known concentration in the water. The fish basically breathes it in over the gills, absorbs it over the gills, and then goes to sleep.
How do we do the ultrasound on our fish?
Well, the ultrasound, actually, if you had one done, or when pregnant ladies have them done, we usually have to lube them up with gel. But the advantage is this fish is surrounded by water, and the water does the same thing as the gel. So all we have to do is put the probe in the water and scan the fish. But if you want to gently just hold the fishy so he's not swimming around, and then we can scan him. Okay, so what you're going to do is just gently reach in, and you're going to turn the fish over on its side. And it might be easier to do it sort of up against the wall, like that. And then I'll go ahead with the probe and I'll scan.
Okay.
Okay?
Ooh, he's slimy.
Yeah, he's slimy. You can keep him in the water. You want him in the water, so lower. There you go. A little lower with your hand. Perfect. Now we're just going to do the scan. So this is inside the fish.
Ooh.
So ultrasound shows us internal of the fish.
So what are we looking at here?
We are looking at spine and muscle. We'll also try to see, we got this line that's actually gas reverberation from the swim bladder. Kurt, your fish looks like a girl. I think I see ovaries. Looks like ovaries right here, all these dots.
Oh yeah.
Wait, that's muscle. That looks like a tuna steak right there. That's muscle. And if I move forward, see all those dots?
Yeah.
That's ovaries. Okay, fish is sleepy enough for us to move him over to the counter to do the rest of our exam. So what we're going to do is we're going to just gently get some water and fishy at the same time. Perfect, thank you. Put him in the water, pick him up, and move him on over. Okay, here we go. We've got the fish on the table, ready for the rest of the exam. We'll go ahead and finish the scan. We can see that the fish is breathing really nicely. You see these flaps on either side? Those are called opercula, and they cover the gills. And so that's basically how we measure respiratory rate. So we watch for the movement, and plus he's swimming a little, so we know he's still a little awake, which is fine. And then here we're gonna do the rest of the scan. So if you can see the screen, again, we can see, and I guess it probably looks like all blah, blah, blah to you. It takes quite a lot of time to learn how to read these, but once you do, it's really a good technique for looking inside the fishies. So here we've got liver of the fish right here. So fish don't put down fat like other animals. They will store fat in their liver. So we look at, the liver should be of a good size, meaning that they're eating enough. The liver is plenty big. And then here again are those eggs. You can see all those little dots. It's like caviar still inside the fish right now. So that's what we're seeing right now. So this fish looks great. I mean, ultrasonographically, and insides look fantastic. Okay, the next thing we're going to do with this fish is we're going to take a skin scrape and a gill clip just to make sure the fish doesn't have any parasites. So what I'm going to ask you to do is just gently hold the fish on its side like that. So the side is at the surface of the water, and you don't really have to grab hard onto the fish. Okay, perfect. And what I'm going to do for the skin scrape is I'm going to take this cover slip, take a little drop of water on my slide, and then just gently run it over the fish. Okay, and the next thing we're going to do after the skin scrape is the gill clip. And so first we just look at the gills and we see they're nice and red and bright red. He says, "Ooh," doesn't like that. It's like I'm sticking my finger up his nose. So he's like, "Ooh."
Yeah.
So what we're going to do, we look at the color, nice bright red. We look at the shape, nice regular filaments, and then we're just going to take a little bit of a clip and put it on the slide to make sure he doesn't have any parasites. So you're doing great holding him. And take my little clip, got it. And then we take that little clip, put it right on our slide.
We are now in the lab with Shelly, where we've taken our gill clip and put it under the microscope. So what are we noticing on the screen?
So what we're looking at here is the actual gill clip that Dr. Karen took and brought over here. And the good news for this fish is we aren't seeing any parasites. These parasites like to live in between all these little gills. I don't see anything. It's looking pretty normal. Okay, so this little guy is called Trichodina. And you could see his cilia moving on the outside of that circle. And it almost looks like a spoke of a bike. The other parasite is Epistylus. So it's these long little guys here, but again, not seeing anything on our clip. So that's looking pretty normal. Another one you guys might be pretty familiar with is ick, is another very common parasite for freshwater fish. Did you have any questions?
No, this is very interesting though. Thank you, Shelly.
You're very welcome. Nice meeting you.
Nice meeting you too.